Comes to giving birth, options for expecting parents are growing, and one of those options is midwifery. You can learn more about that, and to tell us more about how it all works is Dr. Ann Downey, a neonatal intensive care physician at Children's Minnesota, and then Catherine Simon, a midwife at the Mother Baby Center. Thanks so much for educating us about this.
Thanks for having us.
So midwives have been around for centuries, but for folks who may not be familiar, what is a midwife and what do they do?
So a midwife is a practitioner who's skilled in the care of women. We do care for some babies up to about 30 days, but generally our care is with women who are having babies or having physical care with their medical needs throughout their life spectrum.
Okay, so all around.
From
help.
birth to menopause,
Yes.
full spectrum.
Full spectrum. So if someone is interested in going the midwife route when they give birth, I mean, how do they know how to choose the right one?
I think a lot of people fall into the care of midwifery. Maybe their friend or family member had a midwife for their birth and learned about the opportunities. But often it's seeking something different from traditional medical care. It's a relationship-based care and a foundation on the health and wellness of the whole family, the birthing family.
I like that, including the whole family, a little bit more personal. You mentioned traditional. I mean, there have been concerns about giving birth outside of a traditional hospital setting. Are those fears warranted?
I think the reality is birth is not a fearful event, but a lot of us have fears of the unknown. When you look at your care provider, wherever you choose to give care, it's about the continuity of care that you can have if there is some unexpected outcomes. We're very fortunate at Alina and Children's Minnesota to have a full comprehensive care. We have all the way to neonatology, perinatology, and even the lowest risk birth, so water birth, or something that is considered easier, I guess, I don't know, but we have the full complement. And so birth is not scary. It's really being a place where people hear you, listen to you, and can work together with you.
Okay. So you can actually get the best of both worlds, you know, working with the midwife and then also hospital providers working together. How would folks go about that?
Well, I think the reality is when you're pregnant, you're searching for a provider. So who's going to take care of me when I'm pregnant? Unforeseen things can happen. Sometimes there's a medical condition, either by mother, by baby, or something in the health condition that changes. And that's where we partner really well with our partners from Minnesota Children's. We also have our perinatology team, which is our high-risk OB patient providers. So we can call in, I always say we can call in any ologist. And I tell my patients, if I need a pediatric toenail doctor, I can get that person for you. So that's the best of all worlds without having to shop or find they're just immediately available for you.
Exactly. And thoughts about working together?
Yeah, I think that the thing that really aligns us with our colleagues across the OB spectrum, and inclusive of our midwife colleagues, is that we all practice with a very patient-centric and family-centric goal in mind. And so we value our parent voices in the care of their babies. They are true partners with us, and not sort of outside the inner circle of who supports that patient and baby in our case.
Yeah. And including the mom and the entire family is so important, especially during such it can be intense time, but also a special time for families. Thank you both for making us more educated about this topic. We'll have more details about midwives at KARE11.com/noon. We'll be back.